Hi there, I'm Dr. Guy Carnazza. I'd like to welcome you to Discover What's Possible. I practice in the town of East Rockaway, New York, and I'd like to share with you a case that we recently completed of a mandibular full lower arch reconstruction and rehabilitation with a combination of both porcelain crowns, veneers, and bridge work. What we did was not only restore the patient's smile, enhance the aesthetics of his smile, eradicate disease and eliminate decay, and re-engineer his bite for a much smoother transition to the new restorations. So without further ado, let's show you how we did this. This patient first presented to us back in 2009, wanting to redo his mouth and had a lot of concerns about the appearance of his smile and was just unhappy with his teeth. So we actually completed the upper arch back in 2012. And it took the patient a while to really want to get comfortable and get things together to then start doing the lower arch. So after having completed the upper arch, he really wanted to pursue the lower arch. And after talking about it, giving it some time, he finally decided, you know what, I'm going to do it. So what we did was we examined his mouth, and we did find he was grinding his teeth, or what we call bruxing, and ended up wearing and chipping some of his teeth in the front. Also experiencing a lot of decay and breakdown around some old restorations, including some fillings and some crowns, and actually had to have a tooth extracted because it was so severely decayed. And we went ahead and decided to place a bridge rather than do an implant, since we're going to be crowning all of the teeth. So when we do a case of this magnitude, what we do is we take impressions and models and send to our laboratory so our ceramist can mock up, or what we say, wax up the case. And in doing so, we have the case mocked up and we have it mounted on what's called our articulator, so we can examine the case and plan accordingly to engineer both the aesthetics and the occlusion, or what we call the bite. Also, what we received back from the lab are a multitude of shells and matrices which allow us to guide and precisely prepare the teeth exactly for the new restorations, and then let the patient test drive the new teeth in the temporaries, which are based on the mock-up. And the wax-up also lets us then evaluate and go from concept to construction of the ceramic restorations. Then, once we know how we like the way everything looks on the models, we deliver it to the mouth, and we have gone from concept to construction to cementation. And as you can see in this photo right here, there's a big change from what the patient had preoperatively. We've restored both function, health, and aesthetics. We did a combination of porcelain veneers on his anterior teeth, 6 anterior teeth, individual crowns on the lower left teeth, and a fixed bridge on the 4 lower right teeth to hold and replace the missing right first molar. And the patient was ecstatic. The results were phenomenal. We couldn't have asked for a better result, both functionally, aesthetically, and health-wise, because again, we've eliminated a lot of disease. So the patient was very happy, and he told me that people noticed something different about him, but they really weren't sure. They said he looked younger. They asked him, had he lost weight? Did he get a new haircut? And he basically told me all he did was smile because he was so happy from all the compliments that he was getting. This case was a labor of love for me as a dentist, and I'd like to thank our ceramist, Mr. Peter Kravaris, for his excellent detail and magnificent artwork in his dental creations. And if you'd like to learn more about cosmetic dentistry or dental reconstruction, you can visit us online at carnazzadental.com, or if you're in the town of East Rockaway, we're only 20 minutes from the JFK International Airport, in the greater New York area, you can call us and come on in for a free consult. I'd like to say thank you for joining us today for Discover What's Possible, and we'll talk to you soon.